So first and foremost, welcome everyone, and thank you all for spending a precious Saturday night with us. My name is Kok Chi, or Casey for short, and I'll be your host for today. And join with me are Janice and Jerick as chat moderators. So do say hi to them, or hit them up in the chat if you have any queries or difficulties for anything. So this forum we will be exploring the topic on sleep disorders and improving sleep quality, which will be presented by our distinguished speaker, Associate Professor Dr. Luis Andaikalam. But before that, let me first introduce you to the rest of the team, which we call ourselves the REM Project. We are a group of MPU students collaborating with Help University Psychi Honor Society chapter. That's a mouthful, but we're where we are hosting forums and other initiatives to educate the public on the importance of sleep. So yeah, this is us. We have 11 people. Yeah, basically just nice to make a football team out of it. Anyways, let's take a look at the menu for today. The appetizer, that is the launch of the forum, is currently being served, but the entrees, which are our main topics, sleep disorders, and also ways of improving sleep quality, will be presented by our guest speaker before wrap things up with a Q&A as a little sweet dessert. Okay, so I don't mean to bore you guys too much, but here are some ground rules to keep in mind of throughout the forum. Basically, we wish for you guys to keep your mics muted throughout the session unless you want to ask a question during the Q&A, or alternatively, you can post your questions in the chat as well when you do have any questions. That is, while we also like to see all your faces, you can also choose whether or not you want to turn on or off your cameras. And also, please ensure that your display name is also the same name that you registered with. And last but not least, we will be recording the session, which will be uploaded to Psychi's IGTV on Instagram, which is the handle is at Psychi at Help, as well as their YouTube channel. So do keep that in mind. And finally, let me introduce you to our guest speaker before we pass the virtual floor to him. Associate Professor Dr. Lewis is the president of Malaysian Sleep Apnea Association, which was established to assist the Ministry of Health and the Ministry of Human Resources in addressing issues like general health, depression, stress, mental health, and also to reduce workplace incidents and accidents during or whilst commuting to work. He is also the founder of Sleep Recovery Tourism, and his list of credentials will only go on and on, but I believe this in itself is already enough to highlight his expertise on the topic of sleep. So without further ado, let's welcome Professor Doctor to take over from here.
Okay, thank you, Casey. Thank you very much. All right, let me share my slide. I don't think I need to introduce further since Casey has already introduced about myself. Let's move on how do we manage sleep, okay, sleep management. Let us look at what actually the objective of this forum. Basically, I think there are a number of things that we are looking at. Number one is to understand about the topic of sleep disorder, and then how we are going to manage sleep, okay, and then how to get the optimal sleeping pattern, sleep quality, consistency, as well as the importance of sleep itself. So let's study about the importance of sleep itself, and then also look at causes of sleep disorder. Okay, when we talk about sleep disorder, there's actually 96 different types of sleep disorder. Yes, I will not be able to cover all the sleep disorder because I think we have to go to sleep as well. All right, so I will try to cover as many as I can. All right. So that's basically will be the objective of this forum. At the same time, something which is very interesting, that is about COVID-19. Because if you talk about COVID-19, one way you can manage COVID-19 is by having quality sleep, because that builds up your immune system. So we're going to look into a lot of things actually. Some are things that which needed at this point of time. Okay, let's move on. Okay, let's see what I have. Okay, I would like to have this session before I move on to this slide. Let me inform you that I like to joke a lot, and I like to keep the event lively. And I like this thing called the Simbang Santai, that means a casual kind of, session, rather than everybody is like sitting there like this, looking at a professor and then hoping that this guy is going to be a very what do you call it, the normal professor that you see in town. Okay, I like to be a very easygoing guy lah. So that's my forte lah. Okay, let's move on. Let us look at why sleep matters. First thing is understanding about why is it so important we talk about sleep. Okay, let us talk about in a day. Okay, what we do in a day. In fact, I believe I'm not a priest or I'm not a ustad, okay, but I'm just sharing with you that when God created human, he has actually decided to divide a day into three segmentation. Okay, that is, when the people were brought to this earth, God wanted you to sleep 8 hours, okay, then work 8 hours, and then you have to spend time with your family as well as socializing for 8 hours. So that is actually a day's what do you call it, subdivision of time. So if you look at that you're going to spend on bed 8 hours, that means that 8 hours is very crucial. Okay. Having said that, also, if you look at all the holy books, let us talk about Quran. Let us talk about Quran. They have talked 9 times about the importance of sleep in their Sunnah. Correct, Fariza? I'm right, huh? Hey, not bad, huh? This professor knows about Quran also. Huh? Okay, okay. All right, all right. Okay. Because I have to study everything. I have to see from the aspect of what the God says. The God has already said it is important for you to sleep. But we are thinking that, Mola, actually I want to go and party. I want to stay late at night and all that, and we are not sleeping. So 8 hours of sleep is actually very crucial for an adult. You are considered an adult, so 8 hours of sleep is very crucial. So if you look at Bible, in the Bible, I've actually read the Bible. I know it has been mentioned about 99 times in Bible. So you can do a search in the internet and look at in Quran where they mention, in Bible where they have mentioned, in Hinduism where they have mentioned, in Buddhism where the God has mentioned about the importance of sleep. So you see, if we all believe in God, right? Majority of us believe in God lah. So we believe that there must be something which is very important, that God wanted to tell you that you have to sleep. Because this is a natural process. So that is why you must understand sleep is very important. Okay. All right. If you ask me which is more important, is sleep is more important or exercise is more important? Okay. For me, I would say, not because I'm Persatuan Sleep Apnea punya president tau. Okay. I will say sleep is very important because you sleep for 8 hours. Okay. You don't exercise for 8 hours. Is there anyone here who exercise for 8 hours a day? No, definitely no, right? You can exercise for an hour or maybe for 2 hours or so. Okay, maximum 2 hours. Like you're young, like myself, I can exercise about an hour and then I feel exhausted. Enough is enough. Okay, so the exercise has to be very minimal. If you talk about medical doctors, they will ask you to do a very minimal exercise, 30 minutes to 45 minutes, and they will ask you to do something like brisk walking. That's more than enough. Okay, why is this sleep becoming an issue now? Okay, if let me move on to the next slide. I want to show you some pictures lah. Some hitam putih punya pictures lah. Okay, let us see the hitam putih punya pictures lah. This is olden days people. Okay, people who used to be maybe your grandfather or grandmother or grandparents, something like that. Like my grandparents and so forth. They were working like this. So when they work 8 hours, they basically exercise 8 hours because they use a lot of physical. But today, if you look at in this world, all of you, in fact, including me, we are sitting in front of a computer. In Malay, they say a proverb, seperti ikan sepat duduk dalam air. Fariza, betul? Ikan sepat duduk dalam air. That means if you study the nature of ikan sepat, that will sit in the water and it doesn't move. If you touch a bit, then it moves a bit, moves a bit. So we are actually something like that fish lah, ikan sepat lah. Why I say we are like ikan sepat? Because we sit in front of a computer. 90% of our work is involving computer. I think the most used organ in our body could be these two fingers or these fingers because we are flipping the WhatsApp. Okay, so this is what is happening in our life. Ada ke Fariza, you pakai komputer macam ni, you bernafas macam ni? Ada? No, right? Yeah, just joking lah. I simply pick Fariza lah because she's number 3 in the row. Okay, because Jenny is moderating me. Casey is moderating me. I mean, Fariza also moderating me also. Wong also same. But I wanted to just disturb lah, tease a bit lah. Okay. So if you look at it, so we don't, in fact, if you look at even our breathing pattern has changed over these years. Okay, as we come into the modern world, we are digitally breathing. Digitally breathing. We just breathe. Sometimes we ourselves are not sure whether we are breathing. We have to take a benang, letak dekat hidung. Oh, masih bernafas lagi. And then we continue. So breathing is very important. Just to start off with, I always believe in breathing exercises. So what you should do by right is in the morning when you wake up, if you want good sleep, okay, to practice a good sleep, you start breathing by inhaling your the oxygen. Okay, you stand up and do it, and you hold it as long as you can, and then release it slowly out. Okay, so if you do about 5 times in the morning before your breakfast and 5 times before you have your dinner at night, you will see a massive change in your sleeping pattern. That's the simple therapy I can tell you now. Okay, because we forget to breathe. That's the problem. Okay, so this is the first issue. Wow, first slide itself taking so long to check. Okay. Let us look at the second point. Second point. You see, 15% of people who sleep less than 5 hours a night. Because I did a research in Malaysia and I found out that majority of Malaysians are sleeping 6 hours or lesser per night. Okay, so having said that, those of you in this group, there's a lot of you here, please check, are you sleeping less than 5 hours? If you are sleeping less than 5 hours, the possibility of you getting into an accident is very, very high, as well as the mortality risk from diseases. Okay, so it's very high. Okay, so ensure that you sleep at least, the minimum you should be sleeping will be 7 hours. The maximum you should be sleeping is 9 hours. 8 hours is ideal. Okay, so this is very important. And if you look at in the US, 1 out of 5 accidents that happen, which involves motor vehicle, has got to do with sleep deprivation. So it's a very important topic that actually REM has brought in here. And I was very glad, even though it's a Saturday night, it's a party night for me, but normally I go to sleep early, don't take me wrong. Okay, but I decided to come because it's very important. I'm very happy that you all are organizing such an event. Okay, I hope whatever I'm sharing with you all will bring in advantage to your group, for this forum. Okay, let us look at symptoms of sleep disorder. Symptoms of sleep disorder. We are talking about 96 different types of sleep disorder, but let's talk about the common one. The common one. The first one, which is very common among Malaysians, to be very straight, that will be snoring. Snoring is a very common problem that many of us go through. Okay, so you must understand, snoring is not actually a satisfaction of sleeping, but it's actually a problem of sleeping. One of the sleeping disorder. Okay, when you were born, like for example, when Casey was born, I'm very sure Casey has never had snoring. When he was born, he is something like a Yeah, hope not. You better check, Casey, with your mom later. Okay. Okay. When you were born, I doubt you would have snort. Okay. So if you buy a new car, let us say you are getting a Proton Saga from Proton, and then you bring out the car will be very smooth, right? There's no noise. Okay. Given a period of time, maybe 5 to 6 years, the car will start making some noise. Kerang, 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 tang, 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 ting, 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 tong, like that. Then what do? You immediately look for a, what do you call it, workshop, and you send the car. Okay. If you start snoring, it is similar to the car just now. Basically, you had no problem when you did not snore, but when you start snoring, it is a sign that God is showing you something is not right in your body. Okay. So you must remember, snoring has to be corrected immediately. Okay, snoring has to be corrected immediately. So the workshop is my workshop lah at the back. You know, Persatuan Sleep Apnea Malaysia. I run a workshop to repair your snoring. Okay, to correct your snoring. So snoring is one of the biggest issue that is very frequently affects people. The second, why it happens is because sometimes it could be due to as we grow older, we have a lot of tissues that is surrounding the neck, around this area, or sometimes the muscles becomes loose and then it just blocks your breathing passage and you start making the noise. Maksudnya longkang tu sudah jadi sempit lah. Jadi bunyi dah keluar. So something like that. So we go in a very layman language so that it be good for us to this one. Okay, the next thing is choking or gasping sound. Actually, that is what is my persatuan's name, sleep apnea. In Malay, they call it tersedak. That means when you're sleeping, you cough like that. Suddenly, you have a choking sensation. The reason why this choking sensation happens is because you actually have stopped breathing for a certain particular seconds, maybe 30 seconds or 40 seconds or 50 seconds or something like that. But if you stop breathing for a long time and your brain does not react to to kejutkan you, that is when you may have an heart attack or a stroke. And then you end up becoming a vegetable on the bed, or you'll be dead on the bed. Okay. And usually when a person dies on the bed, because it is our theory, that we think that, oh, my grandfather passed away very peacefully. How do you know he died peacefully? That is our assumption, that he died peacefully. Probably he has not died peacefully. He would have had a breathing difficulties, or he has lack of oxygen and would have died. So it is important you to understand that it is not a joke. Sometimes when you're sleeping, you are gasping for, what do you call it, air, and then you tend to turn to left or right. That is when it becomes the leg syndrome. They call it in the medical term. That is when you don't have a proper quality sleep. You are keep moving to the left and to the right because you are finding it difficult. Okay. So you must ask yourself, when you go to bed, do you do this or not? Okay. I don't know lah who sleeps next to you. Okay. The person who sleeps next to you will be the best witness to tell you whether you snore or not. But you all are bujang. How to know lah? Okay, you all are bujang, because very young what? You all are very young. So the only way I can suggest is that one day when Jenny sleeps, maybe Fariza has to sit next to her when she's sleeping. So Fariza should not sleep. Fariza should look at Janice. Apa dia buat masa tidur? Ada tak dia menggigau? Ataupun ada tak dia? So this is one way lah. This is a traditional way of looking at a person, whether the person is sleeping peacefully or whether she's talking in a sleep or whether she is, moving left and right and so forth. So that is one way. The other way you can do is you can fix a CCTV in your room, your bedroom. You fix like MacGyver lah. You fix CCTV and then you sleep, and then you record, and possible you record also your voice. You see what you're talking or snoring or what. So these are simple method of finding out whether you have sleep disorder or not. This is a second common one which is happening. whether that is gasping or choking sensation. Okay, all right. Why some of you are smiling? Yeah, am I talking about you all? Maybe some of you might have this problem. Sorry, yeah. All right, sorry. Okay. Okay, so the third thing is, which is very common, is insomnia, where people are finding it very difficult to go to sleep. Okay, usually when you go to bed, within 10 minutes, you should fall asleep. But if it's taking about 30 minutes, you start thinking, you MCO, when going to end? When this PKP will become PKPB here? And all this worriness, you're thinking about too many things, whether I pass the exam or not, whether I'll have the fees to pay the school fees or not. All this, if you start thinking when you go to bed, this is going to cause you a lot of stress and it is going to affect your sleep. Insomnia is a sign where you don't really able to sleep. And there are many patients out there in Malaysia, especially students who come to me for treatment. They say that, doctor, please lah, doctor, help me to get cured. I'm willing to pay any amount of money because the sleep is, they are of need of sleep so badly, you see. So this kind of thing. And another sign of insomnia is when you keep waking up at 3 in the morning. I don't know whether any one of you experienced this kind of thing or not. I don't know whether Wong experienced this or not. Okay, that means he suddenly wakes up at 3 o'clock and start thinking, ayo, utang belum bayar. Itu hari ni health university buka ke tak ada? Semua, all these things, start worrying. So all these normally happens during night. You see, during night, another interesting thing from my research I found out that majority of the people think negative during bedtime. Correct or not? You all agree or not? That always you have negative thinking, tomorrow I can succeed in my life or not? Can I pass my exam or not? Can I get the job or not? These kind of things. It is always that we think negative thing because when you are in a dark room, this is what happens. We all start thinking negative. But in the next, during the morning time, when you wake up in the morning, you'll find that, never mind lah, I can do it. Something like that. Always positive sign comes in the morning. So that is common. It's very common. And then drowsiness, rasa pening. Rasa pening. Especially when you wake up in the morning. If you wake up in the morning and you have headache, not because you saw your principal, then you get headache. Before seeing the principal, when you wake up in the morning, you say you have headache, that is definitely a sign of sleep disorder. Okay, and one more thing very common that you can also check about yourself is that when you wake up in the morning, do you ask for the sleeping allowance? Not job allowance, sleeping allowance, meaning to say, you tell your mother, Mom, wake me up in 5 more minutes. And I mean, help university can wait, give me 5 more minutes. Then your mom wakes you up in 5 minutes. Then you say, I mean, give me another 2 minutes. Then you wake me up again. If you ask for this kind of allowance, allowance for you to sleep, that means you are having a major sleep problem. That means your brain is saying that you are, what do you call it? You have to go to health university. But then your body is telling, tidur lah, apa mau pergi university. Something like that. So these are all a simple sign in your life. Finding it difficult to wake up in the morning and then unrefreshing sleep and so forth. The other common things that we realize among people who have got sleep symptoms of sleep disorder is sore throat. Very often they get sore throat. Okay, very often they get sore throat, and they also have dry mouth. Always they feel rasa macam pahit lah, rasa macam tak sedap lah, something like that. So why is it you are feeling like this? You see, one thing that I can assure you that you see this thing that we use now, this is actually a very dangerous weapon. I call it a weapon. It's a very dangerous weapon. This is not just an ordinary, stuff. But if you don't use this, very difficult. So you have to use this also. But at the same time, this is also a very dangerous, what do you call it, equipment or weapon that actually causes a lot of people to have things like anxiety disorder, hormone imbalance, and stuff like that. There's a lot of effect of stuff like this, and also your Wi-Fi. the Wi-Fi. But you can't avoid because you're living in a very modern world. So you have to know how to balance it. Balance it. Okay, let's move on. Of course, like for a student like you all, those of you are still in the university, it is very important that you must be able to concentrate on your studies. A lot of people are finding it difficult to concentrate. In fact, some of the students nowadays I notice they also seem to take pills to remember things. They eat pills. They seem to believe on a lot of items which are chemical based, and they tend to take this kind of items because the doctor says that it's okay to take. But if you ask me, I don't believe in all this kind of stuff because all this actually will have some sort of side effects to you, which in long term it's going to affect very much. Then we talk about daytime sleepiness or fatigue. Fatigue. So you see, one of the causes of accident on the road, when we talk about motor vehicle accidents, is due to the fact that the fatigue sets in into your body. So it's very important that you have to understand about how you manage the fatigue by having quantity sleep, that is 8 hours at least, good quality sleep. Let's talk about quality later, and also consistency. Are you consistently sleeping, or are you waking up every 3 hours and then you're going to urine? You're going to the bathroom. If you keep going to the bathroom, you better check your urine. Whether you have diabetes, or whether you're too old, you're having bladder problem. Okay. Or the third thing could be sleep problem. Sleep also is also another issue that makes you wake up in the middle of the night and you tend to go to urine very often. Okay, so as you know, I'm sure you may know, all of you may know that probably you should not consume too much of water at least an hour before you go to bed. Try to cut off taking too much of water before bedtime, but try to consume more water in the morning and afternoon and less water at night. So that may also manage your, body not to process too much of what do you call it, the body to keep on working, your stomach to keep on digesting and so forth. Okay. The other area that I would like to touch is on, of course, it can affect your memory loss. It can decrease your sexual desire. It can also cause irritability. That is why if you see a lot of these road accidents in Malaysia, if you notice, there's a lot of them. Once they meet up with an accident, they become a road bully. Road bully. They can't control their temper. So all this has got some sort of significant, what do you call it, in effect, all due to sleep. So you can see here, what I have covered here is a very few of the areas of symptoms of sleep disorder. Obviously, there's a lot more: sleepwalking, sleep eating, sleep talking, and many other things. But we are not going to go into all that because it will take 3 days, 2 nights for me to cover the whole topic. Okay, all right. So this is just to give some idea. Okay, so far, I don't know whether there's any questions that you'd like to post before I move on to the next slide, because some of you may have some questions you want to ask me now. So better to ask me now. If I can answer, I will answer. If I cannot answer, then I will come back to you. Then someone has to take note of it. Because sleep actually falls under 6 specialists. It does not just fall under a sleep specialist, but it also falls under psychiatrist. It can be a psychiatrist problem. It can be a dental problem. It can be a no respiratory problem and so forth. Or it can be an ENT problem. So I'm not representing all the 6 experts. So whatever I can answer, I will try to answer. Okay. Is there any questions? Anyone wants to raise any questions? Maybe you can unmute and just ask me a question.
Yep, Prof. We have one question here from Angel actually. Who should we consult about snoring? So do we just go to regular clinics?
Okay, very good question. Okay, here I might need to tell you something because when you go to a ENT, for example, ear, nose, and throat, because usually the ear, nose, and throat doctors are the doctors who will be looking into the issues of snoring. But what happens is that in most cases, the doctor will advise you to go for an op. to remove your excessive tissues. So if you ask me, that is not a good idea. Of course, it's good for the medical practitioners because they make more money, because an operation can cost about 20-25K, and that will be paid by your insurance if you have a medical card. So that is the first choice will be given by an ENT doctor. But for me, if you ask me, I will say you can go for a usual people like us, like myself, where we teach you how to strengthen your muscles as well as your tissues so that it does not fall back. That's one. Number two, I would say that you should probably look at how you can reduce your weight. Okay, reducing your weight. By reducing a 10% of your weight, you will be able to actually reduce your snore by 50%. So you should look into that also. So we have to first assess the person and see whether they are having this kind of problem. And when we say snoring, Janice, when we say snoring, we have to also look at how often they snore during at night. That's why we have the sleep diagnosis that we do. Like in my place, I have the sleep diagnosis machine. I give you the machine. It's portable. You take it back home, you fix it, and then you sleep. And then next morning, when you wake up, I would have captured how many times you snore within an hour. Okay, so you sleep for 8 hours. If you would have snored 15 times or more in an hour and stop breathing around that time, at around 15 times in an hour, habis lah. That means you are having major sleep problem lah. So we will study. We have got all these machines that will do the study. So if you ask me, you can of course see the ENT. But if the ENT says, okay, very good, come, I got the laser knife, I will cut then you must say, okay, I'll get the second opinion because it's not a good advice because sometimes when you go and remove the excessive tissue, the tissue will grow. When it grow, it becomes worse. Okay. Okay. Hope I've answered lah. I'm quite a long-winded guy. Okay.
Yep, I think, and I hope, Angel, that answered your question. We take one more question so that Prof can also continue on with the whole presentation, right? So this one is actually quite interesting. Kathleen asks, can we take sleeping pills to cope with insomnia without prescription? And then to follow up with that, some people are using those melatonin vape pens to sleep better. So does it actually work? And all these kind of pills and everything.
Yeah, you see, in the market, there is a lot of this kind of pills. They introduce all kind of pills that to promote sleep and so forth. But all these are chemical based. You will definitely have some sort of side effect. Probably not at this stage. Probably because you are young. Probably given about a 10 years time, 10 to 15 years time, you will have a lot of side effects. Because I've seen patients who have taken sleeping tablet at an early age, and then after a while they become dependable on the medicine. Without the medicine they can't sleep. Okay. And also by right, at your age group you should not have any melatonin problem. You have to just have to have a good sleep hygiene, that which I can share with you later. Okay. So that you can promote a proper sleep. You see, people like me, when I was young, my parents are never been to a university. They never been to a health university or any universities. Probably the education level was only Form 3 or Form 4 or Form 5. They would have studied, you see. But how come those days the people know about sleep hygiene? I'm actually surprised. For example, like my mom, those days, she will tell me before when the time comes to about 8 o'clock, she will say, "Okay, Luis, go and change to your sleeping attire." You see, this is a way for you to actually get your mind to understand that because our mind sometimes is very clever, sometimes very stupid also. So our mind sometimes it programs, oh, this guy is going to sleep, that's why he's changing it into sleeping attire. Then about 8:30, my mom, those days, she asked me to take a half a cup of milk, you know. So I take a half a cup of milk. By 9 o'clock, she asked me to go and brush my teeth. You see, these are all the preparation towards sleeping. So we will dim the light. We will sit. No, of course, at that time, no handphone also lah. So we have no trouble. You see. So we just sit, and then around 9:15 like that, my mom will say, Luis, better go and sleep. Okay. So by 9:30, Fariza, if I'm not sleeping, my mom will give one tight slap. That this is those days lah. I'm talking about those days. But now where got nanti kena dera pula dengan cakap. Because nowadays the children are well informed. If the parents slept, they say, oh, okay, I report to police. Why did you touch me? This. Things has changed lah. So having the proper sleep hygiene and practices in life will become good instead of really taking all these pills and stuff like that. Okay. But anyway, that question was posed by whom? Catherine, is it?
Yep, Kathleen, and
Catherine.
then Elizabeth followed up. Yeah.
Okay. So Catherine and Elizabeth, don't worry. I got a solution. Another four to five slides, I will show you the solution. Naturally, you can solve or in a modern therapy. Okay. All right. Good. Okay. One more questions? Okay. Thanks.
Yeah. Hi, Professor. I have a question from Farisa.
Okay. Yes, please.
She asked, how do we prevent from getting stroke due to sleep apnea?
How do we prevent from?
How do we prevent getting a stroke due to sleep apnea?
Okay. First of all, you must understand the sleep apnea is actually snoring. Okay, snoring is the first one. You start snoring, you must correct your snoring problem. Because once the snoring is not corrected, then the sister comes in. The sister is the sleep apnea. That means you stop breathing. Okay, stop breathing. So if you can avoid at the stage when you start snoring itself, you correct it, then there is no such thing as sleep apnea. There's no such thing as you'll be able to get stroke or you'll be able to get heart attack. Because people do get stroke or heart attack, or sometimes they even get arrhythmia. Arrhythmia where you have your heartbeat which is not according to the adunan, it's not according to the proper design. So it's very dangerous. Yeah, it's no joke. Later part I'm going to show you. The next slide I'm going to show you is about all the medical problem associated to sleep. You'll be shocked to know. Actually, mother of all sickness, if you ask me, is because of sleep. You see, I know from even though you're on the Zoom, some of you I can see your eyes. I know you're not getting proper quality sleep. Sometimes I look at your your texture, or sometimes I look at your size. I will know. I can't see your size lah, but I presume lah, if you're overweight and so forth, it is all due to sleep factor. Because very few people, probably today, this forum, we are the only forum talking in the whole of Malaysia about sleep. Maybe the others all are partying somewhere. So nobody emphasize and focus on sleep. So this is a very good forum. At least we talk about sleep today. Okay. I hope I've answered. So can I just carry on, Janice or Casey? Can I can carry on first? Right. Take this one. Okay, these are medical issues associated to sleep disorder. If you look at sleep related problems, actually mother of all problems starts from sleep. But remember, sleep disorder is actually a time bomb. It's a time bomb that lives within you. Okay, it doesn't give you an immediate effect, but over a long term, over a long period of time, it gives you all kind of issues related to health. Okay, let us talk about the common one first. Let us talk about hypertension. Okay, hypertension. Okay, the last one here you can see hypertension. Okay, assuming today, if Casey decides to go back home, and after he goes back home, he decides not to sleep. Okay, and then tomorrow also he decides not to sleep. And then day after also he decided not to sleep. 3 days continuously he decided not to sleep. On the fourth day, if he goes and sees his doctor and he says, doctor, can you check my high blood pressure? You check my pressure whether okay or not. When the doctor checks, I can assure you your pressure will be high. Just 3 days of no proper sleep will cause you having hypertension. So is it so difficult to get hypertension? Everybody will, many people I see, they say me, hey doctor, saya tak ada hypertension tau, tapi saya punya adik ada. What is so difficult to get? You can get it in a couple of days if you don't sleep properly. So that is a very simple sign of how important is sleep. And a person in Japan, we have done some studies to see how people in Japan, they die by not sleeping for 12 consecutive days. Very dangerous, huh? You see, if you don't sleep for 12 consecutive days, or sometimes depends on your body immunity also lah. If you can, some people have gone up to 17 days, but you see, it is death due to sleep. If you don't sleep, so take it very seriously. That's why it's all in your holy books. Otherwise, it won't be in the holy books. You see, because God knows it's important. It's a natural process that has to be looked after. Then we talk about some of. I'm not going to touch everything, but you have to understand some of these are very important, like diabetes. Okay, we did a Japanese. There was a Japanese lady that we did a study. She slept 4 hours a day continuously for 18 days, 4 hours every day. And on the 19th day, she had type 2 diabetes. You see, type 2 diabetes is a very common diabetes that you can get. And you must understand that it is not only about whether you are taking sugar in your daily food, but it also depends on the sleep. If you don't sleep well, you will get type 2 diabetes very easily. Your sugar level will shoot up. So you must understand, it's no joke. Once you get diabetes, once you get hypertension and you start taking pills, if you start taking pills, sampai ke kubur you kena ambil tu ubat. Sampai your last day. Sebelum masuk kubur pun angkat satu ubat, makan, baru you punya pressure cantik. So don't play. So remember, it's very dangerous. Okay, what are the common other things that I want to touch here? Okay, headache tak apalah. Cancer. Cancer. Okay, there are a few ways you can avoid cancer. There's few ways you can avoid cancer. One of the ways you can avoid cancer is by having good sleep. Otherwise, your body is going to produce a lot of acid. You're going to be more acid, not mild alkaline. You're going to be more acidic. So, sleep is very important. Cancer, okay. The other factor that you have to also look into is if you talk about cancer, you should only eat 8 hours once. You see, in my hometown those days, because I come from a very ulu place, I don't want to mention. Okay, an ulu place, very small place. Okay, during my time, there used to be people I see, especially Chinese, they used to eat 5 times a day, but they eat smaller portion. They just macam ni saja. The meal is over. Those days lah. Nowadays different lah. I go to Kedai Mama, I see you all whack. So same lah, all lah, not only Chinese only, the Malays also same. Last time the nasi lemak so small, the packet. Okay, you just eat 2 spoon, habis already. Now you see nasi lemak tsunami, so big. Got sotong, got everything. Same also goes to Indians. So we have this kind of problems now. Okay, so you have to make sure, because every one of us have got cancer cell. Okay, and the cancer cell, I believe that it needs 27 times more food than the normal cell. Okay, so if you keep eating all the time, you're actually encouraging cancer to set in. Of course, there's also various other ways that you can prevent cancer from, but of course, sleep is one of the ways. Okay, let us look at job impairment. Job impairment. Sometimes you cannot be productive at workplace. When you go to work, you realize that everything you keep forgetting. The boss asks you to prepare the proposal, you forget. The only thing you remember is the salary, end of the month. But others all you tend to forget. So these are common problems that affects a lot of people, and more people who are young, I realize that they have a very short memory. Probably they are into too many things. Of course, they have Instagram, they got Facebook, they got too many things they are attending to. Like those days, we focus on there's no phone, no issues. But that's why I say there's good and bad about the modernization. We cannot live inside the cave. but we must be able to understand areas like this. Okay, talk about COVID-19. COVID-19, I'll come to that later. I think depression. Depression is among one of the very high among students. I do give talks in Sunway University and many other universities. They talk about young students who are having depression, kemurungan in bahasa, they call it kemurungan, and so forth. The kemurungan or depression doesn't just set in like that. One of the thing today, what is lacking among our people is that we don't tend to socialize so much. We don't tend to find friends so much on a socialized reality. Okay, what we tend to do is we have to have fake friends on Facebook, Instagram, and so forth. So communicating to people, talking is something different. So we have to have more forums like this and get to know each other and talk to people and so forth. Okay, when you have something bothering you, you should talk to somebody and make sure that you don't go into silent and then affecting your functions of your body. Yeah. Okay, and the other common one is fatigue, which actually creates accident. You see, as when I did a study on the road accidents, I realized that one of the issue the government did not attend to is about sleep deprivation, which is very important to be attended. Okay, there are a number of factors that affects your driving. One of it is called the micro sleep. You have micro sleep. That is, you tend to uh, drive. Your eyes might be closed or might be open, but your mind is already closed. So you don't even be able to notice a vehicle which is right in front of you. You tend to meet with an accident easily. That's called microsleep, and it happens in a very monotonous situation when you are driving in a straight road and so forth. But on top of that, when it comes to fatigue, okay, when we talk about driving and fatigue, when the fatigue sets in, that's when you start behaving all you start doing all the unwanted things. Like, for example, your hand starts searching for handphone. It is not about attitude. It is about fatigue actually. When fatigue starts setting in, you tend to do a lot of things, like you go and take something, you korek hidung, you ambil tu handphone, macam-macam you buat. Perangai. So this is another problem. The third problem is your reflection time. You see, very good martial artists, if you notice, good fighters in mixed martial art and all that, the first practice that they do is they sleep very well. When they sleep very well, then they go for fight, they are very sharp, and their reflection time is very good. So reflection time plays a very important role in driving as well, so that you don't meet with any point or any kind of accidents. And also health. Number four, health. If you have high blood pressure, if you have diabetes, if you have all kind of health problems, how can you drive competently, or defensive driving, or you'll be able to drive very well? You can't be able to focus. So these are all the issues that actually affecting the road accidents in Malaysia. I would say that many accidents are happening in the road because of this sleep factor. And if you notice that during a festival like Chinese New Year or Hari Raya, we have a culture of all going back to hometown, correct? And when most of the accident happens, when we are coming back from the hometown, it is not that when you're going to your hometown. When you're coming back from your hometown, the accident happens. Why? Because when you go back to your hometown, you don't tend to sleep. You've been spending and yakking, talking to everyone and spending time with family and friends. And then you deprive your sleep. When you are coming, your focus is not on your driving. So these are some of the issues that I can share with you. As for COVID-19, I'll be coming to that shortly because there's one special slide for that. So let's talk about quality of blood.
Sorry,
Quality.
Professor Doctor, can I? Yeah, sorry about it.
Yeah. Yes, Casey.
Yeah, sorry. Cause we're already at 9:27 and
24.
we
Yeah.
wanted to end it by 9:30. So is
Okay.
it okay? So sorry, but is it okay for you to maybe
Yes.
speed through everything and then
Okay.
I mean just give like a quick run through, and then for Q&A
Sure.
maybe we'll not do a live one, but instead we'll compile the
Okay.
questions by the participants and send to you afterwards. after the
Sure.
forum so that you can answer everything then.
Okay, sure, Casey.
Yeah.
I'll do that. I'll go like that. I'll go like
Okay.
that, Casey. And then also, actually, it's big time, right? Yeah, it's
Yeah,
going to be big
true,
time, right?
true.
Yeah. Yeah, true. Okay, thanks. Okay. Quality of blood, as you know, we have to have mild alkaline. But basically, when you look at the quality of blood today, it's not towards mild alkaline, but it's very acidic. So this is another problem created by non-quality sleep. Okay, quality sleep promotes good blood, and also causes of poor quality of blood. Obviously, one of the issue will be sleep quality, or dietary imbalance, excessive stress, and lack of exercise. So, continuing exercise on a daily basis for 30 minutes to 45 minutes also promotes good sleep. So this is something that you all can practice as well. Okay, so here when we come to the slide number 7, I'm talking about quality sleep in terms of whether are you getting the right amount of sleep or not. We are talking about light sleep, deep sleep, and REM sleep, rapid eye movement sleep. Okay, so in a night you should be getting at least 3 hours of deep sleep. By having a deep sleep, that's when your body, muscles, and the repair work will be happening on your cells and so forth. So, are you getting enough 3 hours of deep sleep or not? That's the first thing. And of course, REM sleep is also very important because that actually helps on chemicals that strengthen and immune your systems and so forth. And it's also for what do you call it? Brain consolidation. So we'll be looking at brain consolidation and so forth. So having a proper 8 hours of sleep is important because a dream comes on 5 episodes per night. Okay, it doesn't come one time. It comes in 5 episodes. To cover 5 episodes, you must at least have an 8 hours of sleep. Otherwise, you can't get the 5 episodes, which is about 90 minutes of REM sleep. Okay, all right. Okay. So the other important aspect is how are we going to overcome this COVID-19 risk? So you want to reduce your COVID-19 risk, you need to sleep more because it's actually a simple bolster for immune system against cold, influenza, and other respiratory infection. So ample sleep supports your immune system. This is one way that you can reduce the risk of infections and so forth. It's proven. Okay, these are some of the articles that talks about achievement among students by having good sleep. It's always they say that it's good to go to sleep early, say around 9:30, 10 o'clock. Good to sleep early. And if you are preparing for your exam, it's good to wake up a bit early and start doing your studies and so forth in the early morning, early hours of the morning, not at the night part. Okay. Of course, I've covered on this sleep well for mental health. It's very important. Okay, and then how it affects on your work. What do you call it? On your productivity. Basically, American Academy of Sleep Medicine has done studies to show that sleepiness, and poor sleep quality actually prevalent among university students that affected academic performance. Okay, so this is something that you have to look into for you to have better grades in your studies and so forth. Okay, and if you notice, this is my picture with our former Prime Minister, Dr. Mahathir bin Mohamad. Okay, he was always talking about how can we increase productivity at workplace. There were some signs of sleep deprivation that actually affects the productivity of people. As you can see on the next page, you can see countries which are developed, such as Japan, they lose billions in economic all due to sleep deprivation, because they can do studies. You see, they can do studies. Even in America, 18 million people are suffering from sleep deprivation. Okay, that works out to 63.2 billion US loss in productivity. So it's very important to see how sleep can actually affect the economy of a country. Yeah. Okay, I'll move on to the next slide. Okay, this is actually Matt Walker. He's also one of my guru. Okay, supposed to meet him last year, but due to COVID-19, I could not meet him in the US. I will play this video, but this video is about 2 to 3 minutes. Is it okay, Casey? Is it, or should I just share it with you all later?
Yeah, sure. I think you can play it.
Played, okay.
Yeah.
Here they talk about sleep hygienes and so forth. Okay.
Hi, my name is Matt Walker. I am a professor of neuroscience at the University of California, Berkeley, and I am also the author of the book Why We Sleep. And I'm here to speak about some tips for getting better sleep. We can all have a bad night of sleep, and that's perfectly normal. But how can we try to improve both the quantity and the quality of our sleep? Here are 6 scientifically grounded tips for better sleep. The first tip is regularity. Go to bed at the same time and wake up at the same time. Regularity is king, and it will actually anchor your sleep and improve both the quantity and the quality. The next tip is temperature. Keep it cool. It turns out that your brain and your body need to drop their core temperature by about 1 degree Celsius or around 2 to 3 degrees Fahrenheit in order to initiate sleep and then to stay asleep. And this is the reason that you will always find it easier to fall asleep in a room that's too cold than too hot. The next tip is darkness. We are a dark deprived society, and in fact we need darkness specifically in the evening to trigger the release of a hormone called melatonin. In the last hour before bed, try to stay away from all of those computer screens and tablets and phones. Dim down half the lights in your house. You'd actually be quite surprised at how sleepy that can make you feel. The next tip is walk it out. Don't stay in bed awake for long periods of time. And the general rule of thumb is if you've been trying to fall asleep and it's been 25 minutes or so, or you've woken up and you can't get back to sleep after 25 minutes, the recommendation is to get out of bed and go and do something different. And the reason is because your brain is an incredibly associative device. The brain has learned the association that the bed is this trigger of wakefulness, and we need to break that association. And by getting out of bed, you can go and do something else. Only return to bed when you're sleepy. The 5th tip is something that we've actually already spoken about in detail in this series, which is the impact of alcohol and caffeine. So a good rule of thumb here is to try to stay away from caffeine in the afternoon and in the evening, and certainly try not to go to bed too tipsy. The final tip, have a lifestyle routine. Any of us in the modern world, we expect to be able to dive into bed at night, switch off the light, and we think that sleep is also just like a light switch, that we should immediately be able to fall asleep. Well, unfortunately, sleep isn't quite like that for most of us. Sleep as a physiological process is much more similar to landing a plane. It takes time for your brain to gradually descend down onto the firm rock of good. 20 minutes before bed, last half an hour, even the last hour, disengage from your computer and your phone and try to do something relaxing.
Yeah, I think that was a good.
Hi, my name is.
Sorry. That was a good tips, I think, from Matt Walker. Okay, this is my sleep recovery center, which is actually located in Plaza Damasri Hartamas. You may visit at the website, which is www.recoveryhub.com.my, or the Insta page. Recover on 2 ways. One is the natural way of improving your sleep. The other one is the modern way of improving sleep. Yeah. So I hope that you will be able to like my Insta page later. But at the same time, these are some of my patients who come to my place. It consists of some are fighters, mixed martial arts fighters. Some are ministers. Some are bodybuilders, and also this is the son-in-law of the king, the current king, who comes to our recovery hub. Okay. What do we have there for you to improve sleep? We have machines like this. This is modern machines. It's called the cryotherapy chamber, which actually helps you to sleeping mode, balancing your hormones, and it also prevents cancer from happening, reduces inflammation, weight loss. It can help you to manage your weight. It burns 800 calories in 3 minutes. Okay, so we have this machine in our center. Beside that, we also have a place called Dream Pod. This is interesting. You will go into a pond like that. You lie down that contains 500 kilogram of Epsom salt. You'll automatically will be floating. Okay, it actually improves your absorption of natural magnesium. It also normalizes your body pressure, decreases stress and anxiety. So these are some of the things that we have in our center that can help the students to recover from sleep issues. So like just now, Catherine was saying about getting for pills and all that. I think you may put that as your next plan, but look at something like this that can help you to settle immediately. It's kind of a center which is like a magic center. You will see an immediate results. Okay. Of course, things like pneumatic compression therapy that also helps because usually people who are suffering through pains may also have problems of sleep, getting quality sleep. Okay. And then we have infrared sauna, which also has got science as well as medical studies, which has shown that it actually improves sleeps and promotes it well. Okay, so obviously when you get into the Insta page, you'll be able to see all these things. Yeah, we also have localized cryotherapy to look at how we can help reduce inflammation and also improve blood circulations and so forth. One of the issues that people do have problem is to get good oxygen saturation in the body and stuff like that, where these machines will be able to help. This is nothing got to do with sleep anyway. This is cryofacial. This is if you want to look good, you can also go through cryofacial. We also have cryo slimming machines in our location now. We also have gone into aesthetic a little bit, okay, at our center. Okay, so that's basically my presentation for today. As Casey was mentioning just now, we are running out of time. All the questions will be posted to me via email and I'll be able to answer. But if you would like to get in touch with me, you can find me on the Facebook at Luis Andaikalam. You can look for through the YouTube, you can look through my website, or you can just Google my name on the Google and you'll be able to find me. Okay, with that, I would like to wish you a very good night and have a sweet dream. Okay.
Doctor, can I just ask one question that was asked by Cheryl? She actually asked, how often do people actually seek these treatments from your center?
Okay. Okay, usually it depends on the what do you call that, the severity of your sleep problem, because you may have a mild sleep disorder, moderate or severe sleep disorder. So if you're having at your age, I presume you may have a very mild sleep disorder. So probably 1 or 2 treatments will show immediate improvement. Immediate improvement. Where people who are having probably a moderate sleep disorder or a severe sleep disorder, probably they go through a number of sessions before they will see the results. Okay. My mobile number is also there for those of you who want to take my mobile number and you want to WhatsApp some of the questions. You are allowed to do so. Okay, but I will be only answering tomorrow. Yeah, because I usually go to bed by 10:30. All right. Yeah. Okay. Any more questions?
Actually, Cheryl did ask if she can know like roughly the range of cost for the treatments.
Okay. So it's not that expensive. Don't be, don't get scared looking at all these, VVIPs coming to our place. And people say, wow, must be very expensive. It's per session it's about 150 to 180 ringgit per session. Yeah, it's very reasonably priced. Yeah,
All right. Thank you, doctor.
thank you. Okay, please like the Insta page so that you'll be able to get all the information there as well. Okay.
All right. So in case there's no more other questions that you guys would want to, urgently raise up at the moment. So if there's none, then yeah, I guess that's about it. And thank you once again, Professor Doctor, for this insightful session. I believe it's been really a beneficial session for everyone, especially to learn more about sleep disorders and also some of the tips that we can to adopt in our sleep hygiene to improve our sleep hygiene as well. So
Yes.
thank you everyone, and thank you Professor Doctor. But before that, can we also, I would like also to invite you guys to maybe turn on your cameras, because we're gonna take a group, take a virtual picture to like kind of commemorate this event. So yeah, on to you, Farisa, maybe if you can guide us through.
Okay, so I'm gonna give a few seconds for you guys to turn on your cameras. Okay.
Okay, Fariza, just a humble request. There's one picture I would like you to take like this.
Oh, okay, yeah, sure.
All of us do like this,
Of
but with
course.
eyes open, okay? Yeah, that's our
With eyes open,
with eyes open, yes, please.
bukan patut eyes closed ke?
Patut eyes close, tapi kita tak nak eyes close, kita buat macam kita, masih, promote.
Okay. All right. So are you guys ready? Okay, so let's have like the smiling pose first. Then we will take the one like the doctor wants, okay? All right. So 1, 2, 3, smile. Wait. Okay. Okay, wait, let me see this. Okay, wait, let me take a shot of the second page as well. Okay, 1, 2, smile, guys. Okay.
Okay.
Okay, now the pose that doctor
On
suggested.
the, okay, right hand side, okay.
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 Okay,
Smile,
1, 2. Okay.
all right.
And the second page. Okay, are you guys ready? Okay, 1, 2, smile. All right. Okay.
All right. Okay. Thank you so much for cooperating. And before we leave, okay, so sorry about this, but we're gonna give a little plug here for our next event. Yeah. So Janice, if you could pull this up, the slide up. Yeah. So basically, we're having our second forum, or actually activity, next week on 20th of March, 8 to 9:30 p.m. Basically, it's a yoga slumber party. Yeah. Basically, we're going to do about yoga. We're gonna do like meditation in, and basically learn on how we can improve our sleep. Yeah, so it'll be on Zoom as well. If you guys can register, if you guys are interested to register, the link is also sent into the chat. And yeah, basically also the dress code is like sleepwear and yoga outfit. Yeah, so that is all about for our small plug. Yeah, thank you so much for listening. And yeah, thank you. And in general, thank you so much for joining us tonight. We hope that you guys gain some tips on how to sleep better in general. So yeah, that's that. And thank you so much.